Good evening and welcome to Montgomery Heart and Wellness. And I apologize, there were some technical difficulties with our 7:45 broadcast, but I'm coming to you 5 minutes a little bit late. However, it's better late than never. We're going to talk about a very important topic today. It is heart disease that worsens diabetes, or essentially heart disease that manifests as worsening diabetes. And it's an important topic. This is going to be a discussion based on a patient I saw very recently. So I'm going to give you a case presentation similar to what we do in our medical training. And so I'm going to take you into either medical school or residency or cardiology fellowship. And I'll give you a case presentation and we're going to talk through how this patient presents clinically. And we're going to talk about what should happen and what we should think about this patient. And I'm going to go through some of the basic aspects of the underlying condition. So again, heart disease presenting as worsening diabetes. So I'm going to share a simple little PowerPoint with you, and we're going to get with our case presentation. But before I do that, I frequently get questions in the comment section about how can I get started, what do I need to do, etc. So I want to give you a few bullet points in terms of our philosophy, key resources that we have. We have a lot of different resources. You go to our website, there's a lot. And so there's some key things you can do instead of trying to work your way through that maze. The simple first step, if you haven't read our book, that's the first step, The Food Prescription for Better Health. It's on Amazon. You can join our community. Many of you have specific questions about health illnesses. You can talk to me directly. And of course, you can schedule an assessment call if you have more complex questions and the like. So let's get to our topic at hand. So we're going to talk about an 88-year-old man who presented with what we call DKA. So what is DKA? So we're going to talk about that. This 88-year-old man has a medical history of type 2 diabetes, high blood pressure, and he had a stent placed in his heart about 15 years ago. He's admitted to the hospital acutely with a fasting blood sugar of 850 milligrams a deciliter. They also found an increased amount of blood, and it's not in a splint, it's blood in his acidosis in his blood. So excuse my typo here. Anyway, he's admitted to the ICU with a diagnosis of diabetic ketoacidosis. So diabetic ketoacidosis is when your blood sugar gets so bad, the acid levels build up, and your metabolic processes are so deranged, you start to build up increased acid in your blood. And so it's associated with uncontrolled diabetes and acidosis, we call, and you also have ketones in your blood because the excess glucose is being metabolized and you're spilling ketones in the urine. And so that we call that a ketosis. You can also have a starvation ketosis. Now, in this situation, he's admitted to the ICU. So the main concern in a patient with diabetic ketoacidosis is to get the blood sugar under control and get the acid under control. So typically we infuse insulin, we hydrate the patient, typically admitted to an ICU or some similar unit. And so he's given intravenous insulin. We monitor the blood sugar, monitor blood gases, and eventually we get the reduction in acidosis in the blood, not the splint. I dictated this and didn't proofread my dictation. Other clinical symptoms that this patient reported. Now, of course, he comes to the emergency room and the nurses check the vitals and everything. They see, do an active check. The patient has thirst and other symptoms. They look lethargic sometimes. And so patients with this high of a blood sugar can look dehydrated. They can be lethargic. They can be have an altered mental status. But this patient has a report by the patient or family member stated that the patient reported some symptoms of some chest discomfort. The patient also had some nausea and vomiting and 2 to 3 days of worsening appetite prior to the onset. So now we have the diabetic ketoacidosis, you have these other symptoms that they present with. So other than the increase in blood sugar and the diagnosis of diabetic ketoacidosis, what other problems should we be concerned about in this patient's presentation? So, this is an important issue to consider, because oftentimes patients present with an acute issue, but there's an underlying issue that's causing that acute problem. And in the rush and appropriately the expedition of addressing the acute problem first, once that acute problem is addressed, sometimes that underlying problem may not be addressed. And so if we were in a situation where I was presenting this to a group of medical residents, I would ask them, what are some of the other issues you want to consider? What's your differential diagnosis in this patient other than diabetic ketoacidosis and worsening blood sugar? Because it's important to consider what's underlying. I will tell you that when somebody comes in, well, first and foremost, with this patient, let me just bring up this PowerPoint. Two things that I highlight. This person is a type 2 diabetic, and they're coming in with diabetic ketoacidosis. So those of you who have a medical background, you'll know that it's unusual for someone with type 2 diabetes at this age to present with diabetic ketoacidosis. Typically, they don't. Typically, it's somebody who has type 1 diabetes or a very poor functioning pancreas who is at risk for diabetic ketoacidosis. So when you have someone with type 2 diabetes, and they come in with diabetic ketoacidosis, you want to think about an underlying cause. What's triggering? What's driving it? There used to be a mnemonic in medical school or training that says infection, infarction, and non-compliance. So infection could be an underlying infection, could be an abscess. Oftentimes diabetics come in and they may step on a nail, don't know it because they have numbness in their feet. The infection smolder and the blood sugar gets worse, become more difficult to control, and the infection may become systemic. They can get gangrene or early infection without knowing it, and a systemic infection without knowing it, and come in with diabetic ketoacidosis. Infarction, short for myocardial infarction or heart attack. And it's not only a heart attack, it can be an acute cardiac event. And the other issue is non-compliance. Now, I didn't specify the compliance here, but if you know that the patient has been compliant with their blood sugar, their medication, then non-compliance is taken out. Infection, infarction, or infection cardiac event are left. And those two are pretty much similar. So why does an infection and or an acute cardiac event cause diabetic ketoacidosis? And the answer is that it's very simple. When you have an infection, the body's immune system is revved up. When your immune system is revved up, you have increased inflammation and increased oxidative stress. Those things also increase the adrenaline system. So you have increased amount of adrenaline that's put, so heart rate goes up. When someone has an infection, you have a fever, you have increased heart rate. Sometimes the blood pressure goes up with that. So you have an increased catecholamines, the sympathetic nervous system driven. Well, guess what? A sympathetic nervous system that's increased and that's elevated will also mobilize blood sugar. And it'll create a situation where you have increased blood glucose. And also the increased metabolic strain and stress can cause an acidosis. And so you can present with either increased blood sugar without an acidosis, or you can have an increased blood sugar with an acidosis with a smoldering infection. The other thing is that a heart attack, when someone's having a heart attack or some similar type event, they can have an acute coronary event, heart attack, or acute what we call ischemic event, where there's a sudden shut off of blood flow to the heart muscle. That can cause an increase in sympathetic nervous system, and cause mobilization of blood sugar, etc. And the other cardiovascular event, you can have a shut off of blood flow to another part of the body. For example, the gut, the GI tract. So this patient had chest discomfort. He also had nausea and vomiting. So he could have also ischemic gut, or he could be having an acute heart attack. And so these are things you think about when someone's coming in and the blood sugar is elevated or difficult to control, and there's a amount of acidosis in the blood. And so other things you need to consider when they present in that situation. Now, so key signs of worsening diabetes, 2 key signs. One, if your blood glucose levels are difficult to control, that's a key sign that there's something underlying problem. The other thing, diabetic ketoacidosis, is another key sign. Now, you're at home, you have diabetes or a loved one has diabetes, you're not going to be diagnosing diabetic ketoacidosis. But if you have a loved one who's getting sick, maybe they have a little fever, maybe they have loss of appetite, they have a little chest discomfort, increased fatigue, increased shortness of breath. If you also notice that the blood sugar is more difficult to control, higher than usual, that's a telltale sign that these symptoms of fatigue, shortness of breath, low-grade fever is having a systemic effect on the body, because a poorly controlled blood glucose is something that is a sign that, hey, the metabolism is becoming less controlled. So if you notice these things early on, then you can start to take action to prevent progression of this clinical course. So key cardiovascular events that can worsen diabetes, a heart attack, we talked about that. And so the mechanism is one where you have increased sympathetic tone, you have increase in adrenaline production, a reduction in blood flow to the heart muscle, that's severe sudden ischemia. The mechanism here is where you have shut off of blood flow to, let's say, the GI tract. If the GI tract loses blood flow, you have increased oxidative stress, increased inflammation. You can have a leaky gut. You can also have an associated infection with an ischemic gut. So you can have two things going on that's triggering the increased blood sugar. And reduction in blood flow to another major organ, I mentioned muscle, GI tract, or the like. So these are the types of things that can be the underlying causes of increased blood sugar that's due to underlying cardiovascular event. Why is it important to recognize these things? It's important to recognize these things because if you have a situation, once you've gotten the blood sugar under control, well, if you're not recognized as there's an underlying heart attack, that condition is progressing. Or if you're not recognized as an underlying ischemic gut or something like that, that condition can progress and can also threaten the health and well-being of the person with the presentation. But what can you do as a patient? You think, okay, this is a presentation. You say, well, this is only for healthcare professionals. Not really. We want to make you aware and understand these mechanisms so that if you start to see signs of, hey, you got symptoms of maybe heart disease, especially someone with known heart disease. This patient had a history of stent placed 15 years ago. That was a clue that I gave you. So you have underlying known heart disease and somebody has worsening diabetes. You want to think of, hey, could this be worsening heart disease, an acute cardiac event? Because everyone who has a heart attack doesn't have crushing chest pain. Everyone who has acute ischemic gut or acute ischemia to the muscle may not have the severe symptom of acute ischemic gut, such as obstruction and nausea and vomiting. They may have a loss of appetite only, or loss of appetite, mild abdominal pain. But you want to think about these symptoms associated with increased blood sugar, and could there be a cardiovascular event associated with that increase in blood sugar? So anyway, what steps you can take to prevent these events? First and foremost, you want to know your body, know what's normal in your blood sugar. If you stay on top of your blood glucose levels, what's normal for you? If you know what your baseline is, you start to say, well, my blood sugar is much higher. I'm sticking with my diet. I'm compliant with my medications, but I'm feeling sick in another way. I'm having chest discomfort, I'm having shortness of breath. I'm having swelling in my legs, and my blood sugar is very high. Then you will know that, hey, there's some things that are off. Let's get this addressed sooner than later. So knowing what your baseline blood sugars are is important. Become aware of symptoms of acute heart disease. Those symptoms are substernal chest discomfort. They can be nausea and vomiting. They can be sudden onset shortness of breath. They can be fatigue or exertional fatigue or sudden worsening in energy. Some people walk, you get up one day, you can walk you normally walk 2 miles every day, and one day you get up, you can just barely make it 1 block, and you're wiped out, you're short of breath, you sweat. That could be an onset of symptoms of heart disease, even though you may not have crushing chest discomfort. So, and also abdominal pain can be a sign of heart disease, or it can be a sign of cardiovascular problems. Sudden onset of pain in the extremities, a coldness of an extremity, could be an acute event in an extremity. So it can be a vascular shut off to a leg. So that can also be associated with increased blood sugar, suboptimal control of blood glucose. And that can be an acute event, because if people have a sudden cold leg, may need to present to a hospital to get that issue addressed. And understand simple nutritional steps to prevent these things. Obviously, you want to always eat a healthy diet. We promote a plant-based diet in our community. It's one of the things that help maintain optimal control of not only your blood sugar, but if you have underlying heart disease and vascular disease, it helps control these conditions too. If you splurge from your diet, so let's say you're eating a healthy diet, but you went to a reunion or you went to some party and you know you ate some horrible food, and then you start having symptoms of suboptimal blood sugar control, along with shortness of breath, along with chest discomfort, along with abdominal pain or extremity pain, know that you could have triggered a cardiovascular event that's causing the blood sugar to be elevated. So it's not just the bad food causing the blood sugar to be elevated. The bad food can trigger a cardiovascular event that can then cause the blood sugar to be elevated. So keep these things in mind. These are clinical presentations that we see on a regular basis. And what brought to my mind to discuss this with you today is a patient that we had recently who presented in a very similar fashion as this patient. And we recognized that, wait a minute, she went in with elevated blood sugar, acidosis, et cetera, but she has underlying problems. And we did some imaging studies and saw that this patient has some severe vascular problems in the GI tract that needs to be addressed. And so this is something that we want to make you aware of, so that you're able to address this, not only from the standpoint of preventing it yourself, but if your loved one is admitted to a hospital, you can ask intelligent questions of your doctor. So I hope this was very helpful to you. If you're new to this channel and you'd like to hear more information about this, of course, subscribe to the channel, hit the likes button so we can get more support on the YouTube algorithm, and of course, share this information. And of course, put all your questions in the comment section. We will address them as we're able to. And until next time, you take care.